Hello, I'm sitting here in my office in the Rayburn House office building across the street from the Capitol, and in a few minutes I will be going over to cast a vote to hopefully repeal the health care legislation that was passed last year by the Congress in a very partisan way. In fact, one of my hopes is that we can get this bill stopped and start a bipartisan effort to reform our medical care system, because certainly we need major reforms in our health care. Especially what we need are reforms to make health care cheaper and more affordable in this country, and that's not the way that this current bill, the one we passed last year, that was a totally one-sided partisan bill, that's not the way that it will be done if that legislation remains in effect. I can tell you that we simply cannot afford the way we are going with the bill that was passed by the last Congress. They did all sorts of budgetary gimmicks to hold the cost, or the estimated cost, to barely below $1 trillion, because they were afraid to go over the $1 trillion figure for public relations purposes. But all federal health care estimates throughout history have way underestimated the total cost. I mean, for instance, Medicare ended up costing, after its first 25 years, 12 times what the official federal government estimates were when that legislation passed. The same will be true of this bill if it's allowed to remain in effect, and that's one of many reasons why I'm going to vote in favor of repealing this bill, because we simply need to start over. And as I said, we need to start in a more bipartisan way. In today's Washington Times, Dr. David Gratzer, a senior fellow at the Manhattan Institute, he said the health care law, quote, includes new regulations that will add to the cost of insurance, reduce competition among insurers, and increase health care bureaucracy. And I don't believe anybody wants to increase health care bureaucracy. It's already too bureaucratic in the first place. In the early 90s, I went to a reception in Lebanon, Tennessee, where I was born. And the doctor who delivered me came and brought my records. And I asked him at that time, how much did he charge back then? He told me he charged $60 for 9 months of care and the delivery if they could afford it. Medical care used to be cheap and affordable by almost everyone. And we took what was a very minor problem for a very few people, and we turned it into a massive, major, terrible problem for almost everybody in this country. In fact, I doubt there's anybody other than Warren Buffett and Bill Gates and a few others that couldn't be just wiped out by some sort of major catastrophic illness or accident happening in their family. And that's not the way it should be in this country. But the only way we can bring down health care costs is if we go more in a free market direction, free enterprise direction. And we're going in the opposite direction now, going to more control by the federal government. And that has never worked any place in this world. Sometimes people will say, well, in such and such country, such and such system is working. But if you look at those countries, it's almost always countries with 5 or 10% of the population of the United States, with a much more homogeneous population, without anywhere close to the crime problem and the welfare problem that we have in this country today. And all of those add greatly to our medical costs in this nation. I remember talking to Jim Morris when he was the head of the Park West Hospital in West Knoxville. I asked him, I said, how much would medical costs come down if you could get the federal government out of the medical business? He said he estimated they would come down 50% overnight and another 50% within the next 6 months. So his estimate was they would be 25% of what they are. If you could get the insurance companies out too, so that we weren't paying for medical care through a third-party payer system, I doubt that medical costs would be even 10% of what they are now. But some people would say, well, gosh, you can't do that. And I realize that it can't be done. But they say medical care is a necessity. You can't pay for it in that way. But I'll tell you, food is a necessity. All I'm simply saying is that medical care would be a tiny fraction of what it costs now if we paid for medical care the same way we pay for food, clothing, housing, and so forth, our other major necessities that we have in this country today. But we can't get the government and the insurance companies out of it, so what do we need to do? We need to go more in the direction of a medical savings account, medical voucher type system, medical savings accounts for those who have jobs, medical vouchers for those who don't or who can't afford it. And we need to do some other, there are all sorts of other common sense reforms we can do as well to make medical care much, much cheaper. But that's not the direction we're headed in with this current bill. And that's why I'm voting for repeal, because if we stay with the bill that the Congress passed in the very partisan way last year, then slowly over the next few years, medical care will become much more expensive. It will become much more bureaucratic. It will end up having shortages and waiting periods, and all with a very declining quality of medical care, all at much greater expense.